Good afternoon, everyone. Allison Skyberg here, Consolidated Planning Group, and we are back today with Lauren Chenoweth, and we are talking today about long-term supports for employment and more. And this is actually a part two. So we had part one a couple of weeks ago. We didn't get all the way through, and instead of rushing through, we decided to do a part two to this. I do have some write-in questions today, so we're going to get to those. I always like to go through the housekeeping items first. Um, we are in webinar mode today, and that means that we can't see you or hear you, but we do know that you're here, and we're glad that you're here with us today. If you have a question, we do invite you to put your questions in the chat box. If you already emailed them to me, I do have them, and we're going to get through just as many questions as we can during the time that we have together. Consolidated Planning Group is a holistic special needs financial planning firm. We're nationally certified as Social Security advisors, members of the Special Needs Planning Academy. Our whole firm is nuanced in planning for a loved one with a disability for their future, both today and when you're gone. So we help people figure out how much money do we need to fund a special needs trust. We help people know exactly when and how to apply for public benefits such as SSI, which that was one of our questions is there help for applying for SSI for my child? There absolutely is. Consolidated Planning Group, we always offer free personalized consultations. So if you have questions today that didn't get answered, we'd be happy to chat with you, kind of hear about where you are on the planning trail, what questions that you have. That's so broad. When we have kids that are transitioning into adulthood, we're thinking about things about guardianship or alternatives to guardianship. We're thinking about having money in the right buckets to preserve eligibility for state and federally funded programs, maybe Medicaid, maybe SSI, things like that. And we can help with all of those things. So today, thank you, Lauren, for being back here with us today. Lauren has been a go-to for me for years. She's very, very just sharp on all of these topics. And when you have one of those, she's my stump the chump go-to. Like whenever I've got something that nobody can figure out, then I always reach out to her. She's awesome. So there is a question from our first webinar that we didn't get an answer to, and I am going to go ahead and read that. I'm going to start with that question, and then we're going to dive into Ticket to Work. If you were not on for our first webinar, for the first half of this, it was recorded, and we will be happy to send you the recording and a link to the slides. You just have to email us. The recording is on the Consolidated Planning Group YouTube channel. The Consolidated Planning Group YouTube channel has over 500 webinars on planning for special needs. If you can think of the topic, it's probably out there. You can subscribe to that for free and see that for yourself. So here's the question. When an adult with a disability loses SSI and Medicaid due to their own work credits or due to receiving DAC benefits, also known as childhood disability benefits, from a parent, and they reapply for MEPD Medicaid, why are they getting several denial letters for things like Healthy Women's, Medicare Savings Plan, Medicaid buy-in? It's very confusing. And these are people that we know should qualify for some type of continuing eligibility. And so a lot of these families are spending a lot of time on the phone. And so can you just give us some tips of who can parents speak to? You know, we're often told, and in Texas, we're called to call 211, which is Health and Human Services, and that's who runs the state of Texas Medicaid program, that we can actually reach somebody that can help fix this problem. So it seems to me, and I know that it affected my own family, of erroneous denial or cancellation of Medicaid. And it seemed to correlate along when the COVID thing was lifted. Some of it is correlated with people switching from SSI to SSDI under a parent's record, and there seems to be a lot of confusion. I know some steps that I've taken, a few tips. I'll just share a couple of tips that I have as a parent doing this myself. First off, my trick in calling 211 is calling early, 8 o'clock in the morning. If you call at noon, you might sit on hold for 2 or 3 hours, a very long time, and you might get disconnected, and it's very frustrating. But I have found if I call at 8 or 9 o'clock in the morning, I basically don't hold. And if I do hold, it's less than 5 minutes. So that's a pro tip number one. Number two, one of the things that so if you've been erroneously denied, you've reapplied and things like that, the person that answers at 211, I agree, they usually cannot help you. They usually don't have a broad understanding of what's going on and they can't help you. So I politely ask to be transferred to a team lead at Health and Human Services. I say, I've got a complicated situation. It's a loss of Medicaid. The child's about to lose a waiver or whatever your situation is. This is an emergency situation and I really need to be transferred to a team lead, somebody that can help me at Health and Human Services. So that is one thing that I do. And I will say, in fairness, they are trained to tell you 10 ways to Sunday on why they can't transfer you. They'll ask you when you did your application, has it been 60 days, et cetera, et cetera. But if you stand firm and you don't have to be mean, say, I really need to be transferred to a team lead at Health and Human Services. I have had great luck at getting transferred. And I have had sometimes where I got the person on the phone and they fixed the situation, not that big situation of, Medicaid being erroneously denied, but I've had a lot of things fixed that way. So that is one way. And Lauren and I were also talking about, so what if, Medicaid got canceled and you were told to do a new H 1200 application or a new Medicaid application, and then that was denied, or maybe you've been denied on appeal. Lauren, talk to us about the next steps and maybe the ombudsman's office and contacting a senator. Kind of talk about escalation when it's a big issue and you're not getting any results.
Yeah, so if you're really struggling, of course, I always recommend that you ask to speak to an MEPD trained worker. Also, that team lead idea is a good idea, it seems like. You want to be sure when you apply that you're marking, if you're a childhood disability beneficiary or disabled adult child, that you're writing that on your application and making that clear. You also, before I get into escalation, I'll talk about a couple things. Community partners, that's a program that is fantastic. HHSC has a community partner program where they have different agencies can apply and be sort of contracted with HHSC to be a community partner and assist people in applying for Medicaid. And there's varying levels, but some of them have some back end access into your Texas benefits, which can be very helpful. They're trained in how to fill out applications and they're able to escalate. So each community partner has like a regional lead. And when there's an issue, they can escalate that to their regional lead who is working in MEPD that can assist in resolving that situation. So that's really helpful. If you're going to waiver, your case manager or service coordinator, as part of their job description, is meant to help you in keeping Medicaid. Now, they don't always have the knowledge for these complex programs and how to do that, but they are meant to assist if they can.
I want to pause
Um,
on that one for a minute because this is a big deal because some people have lost their Medicaid waivers that they waited more than 15 years to get, or their Medicaid waivers are on hold. And so that is one thing, the service coordinator through your local intellectual disability authority. And again, we're speaking for Texas here. The local intellectual disability authority, Harris County is the Harris Center, Fort Bend County might be Texana, it might be Bluebonnet Trails, some of these other ones you've heard of, Integral Care, or some of the other ones that we hear of all the time. So they have a service coordinator, and then the common theme that we're hearing is that the service coordinator was unable to help them. Is there a suggestion on getting that getting that escalated within the LIDA?
Most LIDAs, I think, have somebody that helps with Medicaid. So they may have somebody that specializes in that piece and they may just need to reach out to that person. But it is part of the service description. So you could, of course, go to the waiver, the rules, or the handbook and find where it details. I think in HCS, there's the LIDA handbook And I think that's where it lives, that they're meant to help people maintain their Medicaid and get Medicaid. And I think if you had that ready, that might go a ways towards getting the help that you need.
And then I also heard that in most of these LIDAs have a Medicaid specialist or two within the LIDA. So there is service and support. I always tell people, as far as getting a senator involved, you can go on Google and you can say, who represents me? You can just type that into Google. You're going to put in your zip code, and who represents you is going to pop up. All of your congressmen have websites, and on the website it'll say, are you having a problem with a state or federal entity? Let us help. And then you put your information out there, and then they get involved. And then of course there is the ombudsman's office as well, that can sometimes get things escalated as well. So it's kind of, on one side, what I would say, it's kind of a non-answer, because I can not, and not saying that to you, Lauren, it's because I can say I definitely, as a parent and a professional, have definitely felt like I'm beating my head against the wall with some of these problems, and these problems are big. I mean, it's a big deal when somebody is a quadriplegic and they've lost their waiver and they've lost their attendance services, and it takes 6 months or a year to get this unwound, or it's still not unwound. So I think, I think as a body, as parents, as other professionals that are seeing people going through this, if we don't speak up, then maybe they don't know it's happening. I mean, there needs to be some real change on this, because it's not one isolated incident. So we may need to band together on this to come up with a solution. I think that there's some brokenness that's happening. I don't think it's intentional, but the turnaround time and trying to fix things has been tough, that's for sure. Okay, Lauren, so I know I'm on the LIDA slide. Do I need to move forward or backwards on our slides?
Forward one more.
There we go. Sorry, it just went crazy. All right. So, thank you for that question. And I will tell you, I do know that, this is an issue, and we're working hard to find out some solutions. And I was on the Texas Partners in Policy Making a few years ago, and I have some contacts there, and I'm going to be reaching out to them too, to see if they have any additional answers that might be helpful to you. So I will put that out there, I promise you, as soon as I know.
Okay. Yeah. And the other thing I just wanted to mention, of course, the ombudsman's an option. I think people have had, varying success with that. The other thing is, if you do have a waiver and you lose your Medicaid and you believe it was an error, you believe you should qualify, and you're working to reestablish it, you want to appeal the loss of your waiver and appeal your loss of Medicaid, appeal, and do that quickly, because there's a time limit for when you need to appeal for your waiver to get service coordination or continuation. I think it's within 10 business days, maybe. So as soon as you get that notification, you want to appeal. If you think it was an error, don't just appeal if you know that you should, but if you believe that you should still have Medicaid, go ahead and appeal. And then work with the hearings office to postpone the hearing and let them know, hey, I'm working on getting my Medicaid reestablished. Can we push back this hearing until I've had a chance to do that? And a lot of times they'll work with you on that. That way you're not going into a hearing. Some hearings officers, I think, will leave the record open, even if the person doesn't have Medicaid, but you're kind of taking a risk there. I think it's better to postpone it until you've had a chance to resolve the situation.
Also, I just wanted to say, and I agree with you, on any letters from Health and Human Services, any letters from the Social Security Administration, open them, look at them. They usually have a date, of a timeline of when and how to appeal. But let's say you missed that deadline, and now you're like in a panic, and you're sitting there thinking, oh my goodness, it's definitely been longer than 10 days. There are exceptions to not filing an appeal in a timely manner. And it could be any number of things. It could have been a natural disaster. It could have been some kind of terrible health thing or something else that happened that prevented you from filing the appeal. And you just need to put that request in writing. I'm requesting the appeal deadline, be approved because of the following extenuating circumstances, and I have seen that approved. So I just wanted to mention that. Okay, let's move on. We're going to move on to the ticket to work, and I'll pop in with additional questions. I'm going to mute my video and audio for now, and I'll pop back in.
Okay. And last little note on that. So it's 10 days for service continuation. But I think it's more like 90 days to appeal period. So you could still appeal after 60 days, but you just wouldn't continue to get your waiver services during that time. Okay, on to Ticket to Work employment networks. Okay, so we were talking about long-term services and supports and what's available to support somebody in employment and beyond. And one of the main things is Ticket to Work employment networks. So anybody that's getting Social Security benefits, whether it's SSI, SSDI, et cetera, has what's called a ticket. And when they come to VR, that ticket is assigned to VR. After they finish with VR, they can choose to transfer their ticket to an employment network. And the employment network can continue to provide support. Sometimes job coaching, it may be different services. I think my understanding of it is there's not always an employment network that has staff on site where you're at. So they may or may not be able to provide like in-person job coaching. And the person needs to be earning above substantial gainful activity, which I think is around like 1,600 a month, or be close to it and likely to reach that, because that's how they get reimbursed. But these are public and private companies. There's over 100 employment networks. They might be in the state or outside of the state. And you can find the ones that serve your area by going to SSA Choose Work. And that's a live link, but if you don't have the PowerPoint, you can just type it in, and there's a lot of information about Ticket to Work and how that works. Next, please. Okay, private job coaching, not people's first choice often. However, it can be a valuable option. The Job Accommodation Network, JAN, has some job coaching resources. They also have a ton, and I'll talk about their other resources on the next slide. But this can be an option. Some of these function on like a sliding scale. And so that's available. And a lot of times, or sometimes, if you do have Social Security benefits, it can be considered an impairment related work expense if you're private paying for job coaching. And so sometimes that can be deducted out of, so your check wouldn't be as impacted. So it kind of evens it out. Okay, technology solutions. There's so much technology and it continues to grow and improve. Typically, it's not a solution on its own, but in conjunction with a real person who can assist with that, make sure the technology is still working, meeting the person's needs, maybe checking in, maybe it's like they're doing like an audio visual visit with the person, or monitoring that they've come back from their breaks and things like that. That can work for some people. It's not right for everybody, but it is an option. Again, Jan has a lot of different, it's a wonderful website. Jan's a great website in my opinion. And you can put in what the need is, and it'll bring up the different resources that might be appropriate for that need. Okay. Extended services for youth. A lot of folks don't know about this. So typically VR services are short-term, and we have to close the case as soon as somebody's stable in their employment, which is typically about 90 days after they've gotten into their job. For youth with a disability, it has to be a most significant disability. They can receive what's called extended services for youth through VR that can be up to 4 years or until the person turns 25. So this is an option. It could be job coaching, it could be other things like that. So just know that this is something that you could ask for, especially if the person's on a waiver interest list or something that they think or they think the person's going to be able to be independent eventually, then it makes sense to provide this to get them through until that happens. Yeah, Allison.
Lauren, I think that answers one of the questions that was sent in. Supported employment provisions through TWC. Why can't they support longer to establish the adult at the workplace? So the answer is that they can, but you need to request extended services, and there needs to be a need behind that.
Yeah, and it can only be for youth, and it can only be if they don't have another resource for it. So if
And
you have a waiver,
is
then that would go
youth
through your waiver.
considered between the ages of 14 and 22?
It's up to age 25 for the purposes of
Oh,
this.
that's what you just said. Okay, so only for the youth, but you can definitely ask for that. Great
Yes,
question. Thank you.
yes. Okay, so here is the sequencing of services chart. I recognize that this is a lot, but we're going to break it down bit by bit. Okay, next slide. Oh, okay. So it didn't transfer right into the PDF, but I think I sent it corrected version. So if you get the slides, it'll show, but it has some little arrows just to kind of show you where your eyes are supposed to go. But okay, so let's break it down bit by bit. So let's say you want to work, and this is going to be specific to our waivers because our 1915C waivers have a requirement, and so does Star Plus and MDCP, but they have a requirement that our VR services, work services through VR are exhausted prior to the waiver being able to provide those services. So this is how it has to flow. If somebody's in like an intermediate care facility, state supported living center, somewhere else, they have the option to come to us, but they don't have to. Okay. So let's say that you or your child, family member with a disability wants to work and you're on a waiver. The first step would be that you tell your case manager or service coordinator, different names depending on which program. They should work with you to fill out the Employment First Discovery tool. That tool is in 5 of the waivers. I don't believe it's not an MDCP and it's not in the YES waiver, but it's in the others. This is kind of it's a discovery tool, right? So it talks a little bit about what work the person has done, what they might be interested in, and the filling out of this form then triggers a referral to VR if it ends in the fact that the person wants to work. I typically recommend that people refer to VR using Start My VR if they're on a waiver. I say that because you get an automatic email that confirms that you have reached out and made contact with VR, and then that can be submitted with your waiver plan of care all in the same meeting. It prevents delays because it can be hard to get in touch with case managers, get another meeting going, et cetera. If that doesn't work out, then you should, and I think at the end of this presentation, I have a slide, or maybe it was early on, about how you can find your local office. You can always follow up with your local office if you don't hear back. Yes. Okay. So
Can you mention, we had a question about steps to take so my son can work to
mhm,
support himself. He would need a
mhm.
work helper. Can we talk just a brief minute about job coaches and some of the other services that might be appropriate in that situation?
Yes, yes. Okay. So there's different services depending on, what programs you're involved in. TWCVR can provide job coaching, skills training, soft skills, things like that, somebody to be on site with the person, but it is time limited. Unless you're a youth with a disability, then there is that extended services for youth that's an option. But generally speaking, our services are time limited. And I think there was a question about, why are they designed that way as well? And that's just the nature of our services. That's how they're meant to be. We provide intensive short-term services to help somebody get employed, and then it's meant to transition on to long-term services and supports, whether it's a waiver, natural supports, et cetera. Um, yeah, so somebody needs a job coach. You can either get it through VR, or if you have a waiver, that's also an option. And we're going to talk about sort of what you have to do in order to receive that from the waiver. In part 1, I think I also touched on some of this, but there are some other resources for a job coach. Like I said, we talked about private pay, which is not a first choice, but potentially. Your local IDD authorities or mental health or behavioral health authorities, some of them are able to provide employment assistance, supported employment, those kind of services. So if you don't have a waiver, that's potentially an option to get that kind of support. Okay. So, go back one real quick so I can take that last little step. Okay. So then this last bullet, so you've contacted VR, and then your service coordinator or case manager can add what's called employment assistance to your waiver plan. And you'll want to put competitive integrated employment. You want to make that clear that that's one of your goals or your family member's goals. on their documentation for the waiver. So their person-centered plan, person-directed plan. Each waiver has sort of different forms and different names, but you want to be sure wherever goals are indicated that you make it clear that that's something that the person is wanting to do. Okay. Okay. Now at this point, your VR counselor that you've been assigned to, so you did Start My VR, you did your referral, they called you back, they took your application and did your intake, and now they're going to be determining eligibility. If you get Social Security benefits, you're going to be what's called presumptively eligible, which means we presume that you're eligible. We still have to verify eventually, but you're able to kind of move forward a bit faster. So we're determining if you're eligible. We want to start collaboration between waiver staff and VR staff as early as possible. And that's something I've worked on a lot, is to improve that collaboration, make sure that everybody is getting the proper releases on file early so that we can talk back and forth and keep things as smooth as possible. The waiver can begin to provide employment assistance during this time and can continue to provide employment assistance all the way until we're in active services with VR, which can take up to 180 days. So that's a significant amount of time where you could be getting services. Employment assistance is on the waiver side, and it's essentially anything to help somebody get a job. It's all those job things before you find the job. And then as soon as you find the job, you would transition to what's called supported employment in the waiver. So yeah, helping with applications, helping with soft skills, going to employers, determining interests for work, all those kind of things. And so some people might get employment assistance through the waiver, get a job, and then we would just close your case because you're successfully employed. If you don't need anything else from us, then we close your case and you can continue on with your waiver. Okay. So if we determine that you are ineligible for VR services, usually, especially if you're on a waiver, you're going to be eligible as far as, your needs and having a disability that impairs work, et cetera. Usually what that comes down to is if we determine that your disability is too significant to benefit from our services. That's the language that it says. And we have to do that through trial work. So we have to demonstrate through trial work, putting the person into a work setting and observing, usually 2 or 3 trial work sessions, and seeing how they do with the proper support to see if they're able to work. If at the end of that we determine that they're not ready to work right now, we would close the case, and then your waiver can continue to provide employment assistance. And when you get a job, it would switch to supported employment. And I haven't updated these slides yet, but the new waiver service, employment readiness, I did just get confirmation from HHSC policy over the waivers that employment readiness would work the same way. So just like you can get employment assistance up to that point, you could also be getting employment readiness all the way up until you're in active services. Okay. Okay, so let's say we went down the track where if you're ineligible, now let's go on the track if you are eligible. So we determine you're eligible. Again, your waiver can still be providing employment assistance at this point. We are starting to work on the individualized plan for employment, which is, on the waiver side, we have like your person-centered plan, and you have your budget sheet and all that. So on VR, it's kind of all in this plan for employment, and it's going to document, what service model you and your counselor have determined is best for you, what services you're going to get, how are we going to provide these things, et cetera. And again, waivers still providing employment assistance as we're developing this. Now we want to start, when we're getting close to finishing that individualized plan for employment, we want to start kind of planning for transitioning back over to, for transitioning from your waiver employment assistance over to VR services, so that it can be as smooth as possible. If you can find a provider that provides both for VR and for your waiver, even better. Very smooth transition there. It's just a funding switch. I know that can be hard to find, but so if not, make sure that those two providers are talking, sharing notes, and that they know, what the person needs, what kind of support, et cetera. Okay, so then we sign our IPE, it's complete, and now you're officially in active services with us, which means that the waiver can't be providing employment services at this time anymore. The only exception is that if a person needs transportation and they don't have another resource for it, employment assistance does include a transportation component, and they can continue to use that for transportation only after we get into active services. Some of the waivers, I do like to give this caveat, may push for a more cost-effective option. HCS and Texas Home Living won't allow that. They have provisions that don't allow like habilitation transportation or supported home living transportation to be used related to employment. So it would have to be employment assistance, but some of the other waivers may want you to use like habilitation transportation. Yeah, Allison.
So, is there a such thing? We had a question, a write-in question. Can parents who supervise their children's work be compensated?
I would have to look. I'm trying to think if I think potentially I would have to look at the chart and I can do that and get back to you guys. There's certain waiver qualifications or staff qualifications that allow family members, and then there's some that it can't be a family member. I kind of think you can for supported employment. So then yes, you would be able to be compensated. Um,
So and maybe you can let Meredith know, and when we put the slides and the link to the recording out, we could put that in there. So if
yeah.
a person wanted to find out about that, who would they contact? Is that VR? Is that Ticket to Work through the, so so if we could find out like if it does exist, and if it does, who would they reach out to? Because I had another person say, how could I get help if I'm unable to work due to staffing issues from multiple companies and I'm not able to rely on family. So I don't know if that would help if they could, if they supervise their kids working. I'm not sure if that is one and the same or not. But let's talk about the programs, and this may kind of slide into another question that we have, and we kind of talked about this a little bit early. For those on the spectrum, life coaching, job training, that any programs that may be available for somebody who's getting Medicare and Social Security disability, but maybe not getting a Medicaid waiver. I think we always have to talk about people that aren't getting a Medicaid waiver because I feel like we have more people that are not getting waivers that are on a very long waiting list than we have people getting waivers. Kudos to you if you're getting a waiver. Yay you for knowing to get your kids on the list early or whenever you did and that they finally came up. So we're happy for you, and we might be a little jealous, but we are happy for you. But I would say that there's a lot of people that aren't getting waivers. So let's discuss
Yeah.
that.
Okay. So real quick clarification on the other piece first. So through VR, if you wanted to support your child, you'd have to go through, there's quite a bit more training on our side and certification. I think if you went through all of that and became a certified job skills trainer or whatever and contracted with VR, then you could provide it potentially. On the waiver side, the qualifications are not as high, and I think that a family member can be that. So it'd be more likely that you'd be able to provide it through the waiver. To talk about people that are not on the waiver. So that was a lot of part one. So I do recommend that you come back and listen to part one because I kind of talk about all the things that are available, even beyond waivers. But there's a few different things. Like I said, your local authority or local mental health authority may be able to offer employment supports. I think it's dependent on their funding. Sometimes they're having to use their funding towards crisis services and things like that that they're required to provide, but some do still have some employment supports. So there's that option. There's also community first choice if you have Medicaid and you meet the criteria to be in a waiver as far as meeting like an institutional level of care. Although community first choice is not job coaching, it does have some additional tasks, some habilitation tasks that could support somebody in working. First of all, it can be delivered at work. You have to stay true to the service. So things like, you know, the ADL stuff, so helping with toileting, hygiene, et cetera. But also there's some language about reducing challenging behaviors, helping with interpersonal communication, um, community integration, socialization, those kind of things like that that can help somebody to keep a job potentially if they don't have another resource. There's the extended services for youth, which is a big one. We talked about private job coaching is another option, and then you could potentially write that off as an impairment related work expense. You wouldn't get 100%, but I think it comes to around like half of it is not counted towards your income. And so then it's not taken out of your check, at least on the SSI side. That's it though. Really, the waivers are the most robust source of job services employment supports in Texas. Okay. Oh, go back one. I gotta go over that one. And I do see, let me just address a couple quick questions that are in the chat that I see. If somebody gets a job and loses it, can they open a new VR case and get a new job? Absolutely. You can always come back to us. If you already have a job though, it's going to be limited what we're really able to do for the case and depending on what you need. But absolutely, if you lose a job, yes, you can certainly come back to us. If somebody's working with Texas workforce, it depends on, is there still a need to get started with VR? It depends on what kind of supports you need. Texas workforce, the larger umbrella agency, can offer some different services and supports than VR does. And I believe you can receive both of those at the same time. But VR is able to, it's a more kind of intensive model on the VR side. So there is a few services and things that we can offer that I don't believe Texas workforce can offer. Okay.
I just
Oh,
wanted
go
to
ahead.
say that VR too, like the Workforce Solutions doesn't do testing like the vocational evaluation and some of the other evaluations to see what it is that the person needs to close the gaps on the impediments to employment. So VR is definitely a little bit more robust. You may hear of the Workforce Solutions with the Summer Earn and Learn program or pre-employment training services and things like that. But VR does take a deeper dive, and I think that there's benefits to both. They're kind of all under the same umbrella, but not in Texas. But I think that there are definitely benefits to both of those programs.
Yes. Yeah, and we do try to coordinate. A lot of them are office together ever since the last sunset. That was kind of the plan, is that we've been integrated in, but you know how those big integrations go. Sometimes there still are breakdowns in communication. So yeah, you might be able to get some things through workforce that you're not getting through VR, but there should be communication and you should be able to receive both at the same time.
How long can a person, so a person gets a job and they were supported however long they were, and then they kept the job, so the case was closed.
Mhm.
Is there a period of time that if that person lost the job that they could easily reopen the case, or did they literally have to reapply?
So they would still have to reapply, but there is kind of a fast track, I think is what they call it, where they're able, if it's like within a year, they're able to pull over a lot of the same information that you already provided if it's still accurate. So they would just verify that everything's still accurate and then you would go from there. But yeah, there's not really like a where we would reopen the same case. Okay, and then I see a question about um, benefits planning. How do you get this? And can a person who's not looking to work get benefits planning from TWC? You have to want to work, and you have to have an earnings goal. However, you can come to TWC, get benefits planning, and it's a substantial service, and we can close your case successfully having provided nothing but benefits planning.
Is that true for people? Some people have a loved one with a disability and the person is basically incapable of working. So could they do that as well for that?
Yeah, I mean, the benefits planning that that we would do would be focused on what's going to happen when you go to work. So there's really not a whole lot that I'm thinking of that they would address for somebody that's not looking to go to work. And I know you have to have an earnings goal. So you have to at least, because that's what they're going to base your benefits planning on, right? Here's your earnings goal. Okay, should you make that much, this is how it's going to impact your benefits and when you might, your check might be reduced or when you might go off of benefits, et cetera.
But also, I always like to mention, we probably mentioned this on the first one, that there is free benefit counseling as well through the Social Security Administration, and benefit counseling on whenever I switch over from
Mhm.
SSI to childhood disability benefits or SSDI, or, there is definitely, the bottom line is there's free benefit counseling, whether you're from out of state and it's VR from another state, or through the Social Security Administration, there is free benefit counseling that you can get. You do not have to pay out of pocket for this. And you can find that on the Social Security website and just go to their website and in the search bar say benefit counseling or free benefit counseling and it'll pop up. They have a whole page on it. I've actually looked at that for sure.
Awesome. Okay, I'm going to try to get through these slides real quick and then we can do some more questions. So, okay, so now you have your IPE, you're in active services with VR. You're going to go through our process. And when you get, like, if you're in supported employment, when you get to that final job retention benchmark, so in either of the programs, about 30 days before we get to the point where we're doing job stability or we're just monitoring, because VR is going to monitor for about 90 days to make sure that the person's okay, but we can't provide substantial services during that time. Otherwise, the 90 days starts over. So about 30 days prior to when you're going to need the service from the waiver, you want to be getting with your case manager, service coordinator, getting the supported employment added to your plan. The TWC job skills trainers and things that have been working with your family member or you can share information over to help the service coordinator, case manager request those services on the waiver side, because they're going to have like a baseline and goals and justifications for why you're requesting the number of hours that you are. And then, so then the support employment, we want it to start like for TWC supported employment. We want waiver supported employment to start, which waiver supported employment is just really just kind of the job coaching piece. It's not as robust and broad as TWC supported employment. We want that to come in and start in our job stability when we're just monitoring. That way we can step back in if there's a problem. Assuming all is going well, then we're going to close the case and again, you want to transition back over to your waiver service provider. Okay, next slide. Then once you've transitioned back to your waiver for the long-term services and supports, which is called supported employment in the waivers, if you need more help, you're going to have to make a decision when it's appropriate to come back to VR. I generally say if it fits within the description of supported employment for continuity purposes, et cetera, and if you still have a job, it's best to stay with supported employment through the waiver. If you can't do it through waiver supported employment, then absolutely, if the person wants a different job, they need special training, a certificate, they want to move into a different field, things like that, then absolutely come back to us and open a new case. Okay. And I'll just touch on this. I have quite a few slides about comparable benefits, but I will just say waiver employment services and TWC VR have what's called comparable benefits, which is where a similar service is funded by two different kind of government programs. And the long and short of it is you've got to consider what you need the item or service for. If you need it for work specifically and you have a case open with VR, VR should be providing that. So whether it's rehabilitation technology or, behavior support on the job, things like that. If it's specific to work, then VR should provide it. If it's broader than that, like sometimes I use the example as a hospital bed, right? A hospital bed, sleep is necessary for work. However, sleep is necessary for your whole life. And so when it's a whole life kind of need, it's more appropriate to go through your waiver. Okay. And I think, oh yeah, so some frequently requested ones, vehicle modifications, both programs can provide that. Hospital bed, prosthetics, personal assistance services. Okay, next. I talked about this. You got to consider what benefit the item is going to have. Is it life or work? Okay. These are our bread and butter services: assessment, counseling and guidance, rehabilitation technology, job-related services. We do not need to look for a comparable benefit for these. VR can provide these without having to pursue a comparable benefit. Okay. We can also skip finding a comparable benefit if the progress of that individual towards their job placement or outcomes that they have in their individualized plan for employment is going to be delayed or otherwise, messed up by them not having that service, or if they're at extreme medical risk, we can go ahead and provide the service. Okay, questions. And yeah, my little dog got messed up there, but now we can talk about questions. That's just language we have to put in our thing about where our funding comes from, et cetera. Ah, yay, VR office lookup. So I told y'all that's where you can find your local office. You can always call them, or if Start My VR doesn't work, or you don't hear back from Start My VR, if you don't hear back in a few days, absolutely reach out to your local office. And that's a little QR code. You can scan that. It should work. I think I've tested it.
Okay, so Lauren, one of the things I like to tell people about, because I actually found out about this after my kid was already out of high school and it's only for high school kids. There is also a program, and we have done webinars with them before, called Project Search.
Oh, fantastic program.
That is a fantastic program. So if you haven't heard of that, look up Project Search and look it up for your area. It's for kids that are still in high school, and that includes kids that are staying in high school post age 18. So I totally wish I knew about that program prior to my youngest leaving high school. So Project Search is one of them. And I think that it's all a lot. And I've heard from families. Let's talk about this because this is a real issue, and this might not be like a popular thing to say. But I've heard from families where they've tried to work with VR and they've had frustrating experience. Their counselor won't call them back. They can't keep a counselor. They've jumped through all these hoops. They did all the testing and they've had exactly zero help. Their kid has never found a job. They've never been placed. There's never been a trial work thing or any of these testing ground things happen. So I guess what I want, and I want to just say on the other side of it, I've also had families that have had fantastic counselors and their kid got an awesome job and their kid loved it. And then, it ended up being a long-term situation. So there's both sides of it. But if there are people on here that have been working with VR, they've had a frustrating experience, they're not getting the help that they need, the kid has never had a job, or it's at a standstill. We hear nothing for 7 months at a time, and then you get one email, and then it's another 7 months. What is the recourse for those families? See, the thing is we're dealing with Health and Human Services, we're dealing with the Security Administration, then we're dealing with VR,
It's
and then
exhausting.
it is exhausting, and the communication with each one of those organizations, as I would speak it in my personal experience, is difficult at
Hmm.
best. It's not smooth. It's not fast. Give us some tips because we're here because we want our kids to be the best that they can be. We want them to work if they can work. We want them to be able to try their hand at it. But what do they do if that is the situation? Give us the
Sure.
inside skinny on that.
Sure. So to start, I do want to say, as with all everywhere, we deal with staffing shortages, we deal with people covering caseloads, and I think people, to give them the benefit of the doubt, I think people are doing the best they can. Now, that said, if you are having those kind of issues, usually we recommend that you would go up the chain in that regional office first. So you might ask to speak to the manager. If that doesn't work out, you could go to the deputy regional director, or sometimes there's a supervisor. You would go up the chain within that. Also, all of your VRCs, and I see it a lot of times in their email signatures, but they'll put the Can We Talk brochure, and that guides you through, if you're having issues with VR, how to resolve those and what the process is and what you can do. And I would just say be vocal. I mean, just like everybody in every job, there's people that are better at it than others, and you can request, if you have a good reason, you can request a different counselor if it's just really not working out, the relationship's too damaged, whatever the situation is.
I think my point is don't give up because
Right.
it's
The
easy to feel
services are
frustrated
there.
when you have all these moving parts and nothing and everything's clunky and it's moving poorly. It's easy to just throw in the towel on that. But I think that the work is really important and the training and job coaches and all of the different services are pretty cool. And so as it's working for you, I mean, like I said, there are a lot of families that this has totally been a blessing. So we see some resources on here. Everybody's going to get a copy of
Yes.
today's slides. and a link to the recording. So all these links are going to work for the resources. Thank you for sharing those
Great. I'll
with
just go
us.
over what these are real quick.
Yes,
That
please.
top chart, if you want to see in the waivers who can provide what services, at that link, that chart will tell you which services a family member can provide, but it compares all the waivers. So if you're in a position where you're needing to choose between waivers, you like maybe your slot came up for HCS, you already have class and you don't know which to pick, that's a great resource, and just to see the qualifications, et cetera. The approved diagnostic codes, that helps you know if you qualify as having a developmental disability for purposes of waiver eligibility, because there's a whole list of acceptable diagnoses that the state has said, yes, we consider these to meet the criteria if it occurred before age 22. Sequencing of services chart, that's that chart I took y'all through. If you go to the actual chart, there's a whole text accompaniment, and it goes, each of those boxes is numbered. So you would go to the paragraph that matches the number and it provides additional information. Title 20 community services, that talks about programs that are available through Title 20. I think so. Title 20 are the ones that are not through Medicaid. So if you don't have Medicaid, there may be some supports there, typically not employment, but if you need like attendant care. And then the bottom one is the ones available through straight Medicaid. So if you don't have a waiver, but you do have Medicaid or can get Medicaid, that's what's kind of available.
Awesome. Thank you for that. And the Title 20 is interesting to me. I can't wait to look at that. I don't think I know this. So I
Yeah,
always love when I learn new stuff. This is good.
there's some different stuff. The main one that you might hear about is consumer managed personal attendant services. That's one where if you can direct your own services, and they do a sliding scale based on income, and you don't have to have Medicaid, but it's only available in certain areas.
Cool. So these are the
Um,
waivers, and we do entire presentations on Medicaid waivers. So if you're here today and we were throwing around these Medicaid waivers and you don't know what we're talking about, definitely go check out our YouTube channel and look up the one on Texas Medicaid waivers. You do need to know about it. The waiting list is long. So if you don't know about it, that means your loved one is probably not on the list, and you need to get them on the list as soon as possible so we can help with that as well. And this is going to
little
get,
known, little
I'm
known waiver fact, if you don't have a waiver and your child or loved one has significant medical needs and has Medicaid, if they have Medicaid, they're probably on Star Plus Medicaid, and they can request an upgrade to Star Plus HCBS waiver, and there's no wait. But you
that's,
have to have medical needs, and you have to be
yes.
assessed by your service coordinator. But that, a lot of folks don't know about that. This
Okay.
is who you can reach out to for specific waiver policy questions. And I
That
see
is
somebody ask, can a
great.
12-year-old get a waiver? Yeah, there's not, I think at one point maybe there were some age limitations, but I don't think any of them have. MDCP is for youth, Star Plus is for adults. Yes, waiver is for youth, but other than that, I think they're open up to anyone.
So this is some good information on where you can apply for Medicaid in the state of Texas, yourtexasbenefits.com. The cool thing on this is you put your information in and it automatically applies you for the programs that you would qualify for, so you don't have to know.
And you
Um,
can track your application that way, which
And
is
there
good.
is uploads where you can upload your proof of documentation. Is quite a bit of proof of documentation when you are applying for Medicaid. So, and one little known fact I know is that when you are uploading your documents, they do have to be a PDF, and you need to save it with one name, no, no spaces, no exclamation point or period or anything like that. They're pretty quirky about how you have to save that PDF. So if you ever tried to upload a PDF and it didn't work, just change the name of it, one word in the name, and no special characters or numbers, and then it'll upload just fine. But they also have a fax as well. Um,
Great tip.
so here are,
Ah,
oh, the community partners that you talked about.
yes. And what I love about that is that they have a direct line to somebody to support them that's in MEPD. So they're trained to help you fill out your application and figure out what to put on there and even sit with you, et cetera. But then if there's a problem, they have a direct line to somebody that can help them resolve and escalate it.
Okay, so I just want to reiterate this. So if a person needs help applying for Medicaid, They can go to the Texas Community Partners. They will help them apply for free. You don't have to hire somebody's services to do this. So if you need some help, maybe you don't have a computer, maybe English isn't your first language, or just whatever, it just feels so insurance like and you don't know the answers, there's help for you. I love that. That's great. And I love that it's free. So it's nice. We always have to pay for everything, right? So, okay. And then you've got some more Medicaid resources out here.
Yep.
This is
The
great.
main one that's great on there. So there's the MEPD handbook if you want to learn the rules about the MEPD programs. And then the pink book. So the pink book is like a really nice high level book that kind of goes over everything that Medicaid in Texas offers. They kind of revise it every 2 years. So they just revised it a few months ago. So it's current. Um, and it's a PDF, so you can go control F it, like, which is find, helps you find, so you can find in the document, you could put in autism and see what you could get, what comes up around autism or behavioral supports or, those things.
Awesome. Okay, that's good. The pink book, we always talk about the Social Security blue book and the Social Security red book, and then I always tell people there's no black book. And so I've learned something new today about the pink book, so that's good.
Why
Thank
we
you.
picked pink, I don't know. That seems out of, not
Yeah.
on brand. Maybe we should have had blue, but
For sure, for sure. Well, guys, we do webinars all the time. We're glad that you've attended. We hope you'll attend in the future on a variety of topics, planning for special needs. We do Texas Medicaid waivers, SSI, SSDI, knowing when and how to apply, special needs trust, guardianship, alternatives to guardianship. Those are all webinars that we do on a pretty regular basis. So today, when you get the slide, this link here will take you to our upcoming webinars that you can register for. And we always offer a free personalized consultation. So
oh,
if whether you've done a lot of planning, we've got a lot of people that come to us, they already have an advisor, they come to us because their advisor is not nuanced in special needs. That's okay. We expect you to have an advisor, and we're not here to rain on any good relationships that you already have. So whether you've done a lot of planning and you want a second opinion, you've done a little planning, or you've started and you need to pick up where you left off, we can definitely help you. And I always encourage people not to beat yourself up about where you are in the planning process. It's not about looking back, it's about moving forward and taking that next step. Our lives are hectic. We already talked about all of the hours on the phone that we spend with HHSC, Workforce Commission, VR, and the Social Security Administration as parents with people with disabilities. And so we know it is challenging, but we're here to help and make it easier.
I had one other thought, something I learned about more recently. If you have Medicare, now Medicare will pay for a health navigator. I know Solus is a company that's doing it. I don't know who else is doing it, but you can get somebody that can help make your Medicare appointments, manage your doctor's visits. It's kind of like a concierge service for Medicare. So another great resource if you have Medicare to take a little off your plate.
So, and you can check that out on the Medicare website, Health Navigator, and look that up.
I think so. I know I would Google it. I'm not sure if it talks about it on there. I know one company that I'm aware of is Solus. I don't know what other companies might be out there.
Okay, so as usual, you were a wealth of information today. Thank you, everybody, for attending. Again, if you attended today and you got on right on time and you saw that we were somewhere in the middle of the presentation, you felt confused, sorry for that. We did a part one of this a couple weeks ago that does live on our YouTube channel. If you email us, we'll send you the part one recording again on the YouTube channel. You're going to get an email today with the slides, which is all the slides. So from part one and part two. So thank you for being here with us today. Lauren,
Thanks.
you're awesome. So thanks for all of the information. I eat, sleep, and breathe this all day, every day, but I think I have like 3 new takeaways that I didn't know today. So I feel like I've actually learned something, and I know
That's a win.
that is a total win. So thanks so much, everyone. I hope everybody has a great afternoon, and we'll look forward to catching up with everybody again soon. Bye now.
Bye. Thank you.